this is Dr. Ty from Premier Orthodontics, and today's video we're going to be going over a patient who had jaw surgery. We'll show you why we chose to do surgery on this patient. We'll show you her before and afters, so let's get into it. So this patient here first came to our office when she was about 14 or 15. You can see she's got a pretty large overbite. The top teeth stick out quite a bit. Looking at her profile, you can see she has a recessive chin. So we always take into account the profile of the face as well as the tooth position when we decide on the treatment plan. So as a teenager, we had a few options for how we could treat her. So one option is a Herbst appliance. So Herbst appliances are best used on patients between the ages of about 10 to 12 or 13. So this patient, I believe, was 14 or 15 at the time. So she was a little bit old for a Herbst appliance. There is the option of doing elastics or springs, or extractions, and then jaw surgery, which is primarily used for patients that are over the age of 18. So we didn't think about doing jaw surgery in her case. So we didn't want to do extractions because, again, looking at her profile, we didn't want to bring the top teeth back so much because she had that recessive chin. We wanted to bring everything on the bottom forward. So again, she was kind of late in her years for a Herbst appliance, but we decided to go with that option to try to get as much jaw growth as we could to bring that lower jaw forward and try to help her profile. So this is what a Herbst appliance looks like. We'll show you this animation. So it's an appliance that gets glued on the top and bottom and has a little kind of pivot that goes between the top molars and the bottom teeth. So this is what it looks like, top and bottom. When this is placed, what it will do is it actually postures the lower jaw forward. So in a young growing patient, this will actually help to redirect the jaw growth in a more forward position. At the same time, it will also move the teeth. So this patient, again, she was 14 or 15. A lot of her growth was already over. And so we knew we could hopefully get a little bit of growth, but we knew a lot of the movement we were going to get was dental movement, meaning that we were going to move the teeth. And we were hoping to get some amount of jaw growth as well to help her profile. So this is where she got done. She was in treatment about 2 years. She had a Herbst appliance and braces. You can see we were able to get her profile better. The overbite looks much better as well. And at this point we thought this was a successful treatment, but she ended up coming back in her 20s. And this is how she came back. You can see a lot of that bite correction that we achieved with the Herbst appliance wasn't stable. So that is one risk of using a Herbst appliance in an older teenage patient, is that the bite will relapse, meaning that it will go back. So if you got jaw growth, that doesn't go back. But if all you did was move teeth, what tends to happen is those teeth will slip back into the original position. Also, sometimes patients will continue growing in an unfavorable pattern, meaning that if they started off with a recessive jaw, sometimes their growth pattern still is that direction. So either case, this patient came back and she still didn't like her chin, and she didn't like her overbite, obviously. So at this point, we discussed our treatment options again. We weren't going to do the Herbst appliance in a 20-year-old. We talked about either doing extractions, taking out 2 teeth on the top and bringing those front teeth back, which wasn't going to help her profile, or we could do jaw surgery. So this patient elected to do jaw surgery, and the jaw surgery was trying to bring that lower jaw forward. So this is just kind of a before and after of the patient when she first started with us. The middle shot is after we got her braces off the second time, or the first time rather. And then that third shot is when she came back to us as a 20-year-old. So you can see how much the teeth and bite can relapse and move. I don't think she was perfect at wearing her removable retainers either, so she got a lot of relapse from that. Shows what happens sometimes in later teenage patients if you treat them with a Herbst appliance, is that sometimes it's not totally stable. So this is what jaw surgery looks like. Again, this is for adults only, someone who's done growing. If that lower jaw is really recessed and we want to get more chin projection, we'll put braces on, and then an oral surgeon will do a procedure where he actually goes in and takes a segment of the lower jaw and then slides it forward. Once that jaw is slid forward, he'll plate it into position with titanium plates. And these plates will stay in for life. And so you can see this is what they look like. Again, this is all done under general anesthesia, under surgery. And once that jaw's in position, you get the better lower jaw profile as well as the overbite corrected. So this is what we decided to do. We put this patient into braces, and then she went to an oral surgeon for the procedure. And this is where she got when she was done. So you can see the picture on the right is after surgery and after the braces were removed. You can see the overbite was completely corrected. She got much more chin projection as well. You can see she does still have a little bit of swelling after the surgery. You can see she's kind of got some puffiness around the cheeks and the lower chin. That will go down over time, but you can see how much of a movement was made with the lower jaw coming forward, and that hopefully will be a nice stable result moving forward. So we'll do one final look at the left as an early teenager, large overbite, recessed chin. And then the second shot is after Herbst appliance and braces. And then the third shot is as an adult after some relapses happened. And then the fourth shot is after braces for the second time and jaw surgery. So that shows you kind of the different options we have for correcting overbites, why we might choose one option over another, why not every option is the right option for each patient, and when jaw surgery is appropriate. So if you have any questions about jaw surgery, about Herbst appliance, about overbite correction, ask them in the comment section below. If you haven't yet, make sure to like and subscribe to the channel, and we'll talk to you soon. Thank you so much. Bye-bye.